I'm going to demonstrate how to bandage a leg on a pet using our resident Husky, Hannah, who I realise will be slightly more compliant today than the usual pet. So step 1, take a non-adhesive bandage, shiny side goes down, and apply it to the wound. You just want to rest it there. Don't use anything sticky if you can get away with that, because that's going to be really difficult and painful for Hannah when we need to take it off. Step 2 is your soft layer. So you're going to take this soft layer, you're going to start at the foot, around the top of the foot. See how I've got my fingers either side? Back over the foot, change my finger to the top, around the back, slide my finger out, and keep going so the foot is covered. Once you have the foot covered, you then travel up the leg. Don't go down, always up. So that's layer number 1. The next layer, which is not always used, in this case we will, is your compressive layer. So you see this is very stretchy. It's got some give. Same thing, thumb on the top, over, another finger there, back over, slide your thumb back on top, and then start to go around. Slide your fingers out because you don't want to get bandaged to your pet, and keep going around. Again, work your way up the leg. Do not do this. Look how squeezed Hannah's leg is. That's not going to be comfortable. Absolutely not. Just gentle pressure, really gentle pressure all the way around. The next layer, the final layer, is with the protective cover. I've got a warning about these. These have a lot of stretch and a lot of recoil. If you stretch this out around the leg, once it's bandaged, it's going to recoil to this. It's going to compress the leg, and we're going to have wound problems, and we're going to have constriction, so swelling in anything distal to where this is. So my top tip is to unravel this layer completely, get it loose, and then re-ravel it really gently and passively so that it's slack. That way, when you're applying it, it's easy to get off the roll and you're not having to stretch it around. Okay, same principle again. Thumb on top, over the top, back around, and sideways. Cover the entire foot, because if you've got any bit of little white sticking out, the pet's going to be chewing it. They're going to think it's delicious. They're going to get it off. And there you go. There's your 3-layer bandage plus your non-adhesive cover.
Some more advice on how to keep the bandage on. The most important thing is that you need to go over a joint. So for example, if we had a wound here on you, in order to keep a bandage on, we would need to go over the next joint. So always one joint above where you need the bandage to be. So in this case, if we have a wound here, we're going to bandage to here, which is just above the joint. On Hannah, you can't see her knees, but this should be her knee. And so we've gone just above the knee, and that helps to keep the bandage on. In some cases, you can put some sticky tape around the top. Hopefully you don't need to, but that is an option if you are finding that the bandage is slipping off a lot. The other thing that we need to do with bandages is keep them dry. Absolutely no walking through puddles with these. We use at the clinic an old drip bag, and every veterinary clinic has an absolute excess of these, and we love to reuse and recycle. So what we do is we cut the top of the drip bag, empty the contents out, and then we cut little holes all the way around, and then you can slide some ribbon through. That will fit over your pet's leg. It's different sizes, so we can accommodate whatever we need to do. You slip that on, pull it up over that joint that we mentioned, and then you can tighten your ribbon there. That can be used for walks outside, and that will protect that bandage, stop it from damage, stop it from wicking all of that water and mud up. The last thing you want is a wet, dirty wound underneath there. That will cause an infection, that will cause breakdown of wounds, and it will cause other sores on the leg, which will then exacerbate the problem.